Hi, I'm Deborah.
And I'm Lawrence, and today we're dealing with a significantly heavy topic, I'd say. Suicide, and more specifically, suicidal thoughts and such within the age group of teens. And so this is more,
And kids.
yes. And so we're going to be covering maybe some myths about suicide and giving some maybe, I guess you can call it advice to teens who are suicidal, or maybe if you know a friend who's suicidal. And we're also going to talk about some advice for parents of teens who are suicidal.
Or adults who know a
Yeah.
teen or kid who is suicidal.
Mm-hmm.
The reason we're talking about this is because even before the pandemic started, there was, we were already talking about it because there's been such a rise not only in the rates of anxiety and depression, but also in the rates of suicide. So in suicide rates in youth have increased more than 50% over the last 2 decades. And the rate of suicide is higher among Black youth. It's the second leading cause of death in people 15 to 24. So this was something we were thinking about even before the pandemic started. Now, with apparently a third of people in the U.S. Being, depressed who were not depressed before, and especially this is affecting kids and teens, youth to a great extent, as great an extent as in adults, if not more. Then it's something that's really, really crucial to talk about.
Yep.
So there are some myths that, to be honest, I didn't know people actually still believed. But on the other hand, I've been learning about and writing about depression since, pretty much since I was diagnosed in 1990. So,
Yeah, but I mean, humanity is pretty stupid, you gotta be honest. So it's not a surprise people still believe dumb myths.
well, I don't know. But anyway, so myth one is people who talk about suicide never actually do it. That's
Definitely not true.
Yeah.
I mean,
it's a warning sign. If someone's talking about suicide, then you need to listen.
it doesn't always mean they're going to do it that second.
Right.
But yeah, as she said, it's a warning sign.
Yeah.
It's like, hey, they're talking about suicide. Maybe you should
Yeah.
take some action.
Take it
about
seriously. Myth two, if a person has decided to commit suicide, you can't talk them out of it. That is not true.
It's possible to talk them out.
Not 100, maybe not 100% of the time. However you intervene is, or how when people intervene, 100% of the time, does it keep someone from ultimately committing
No.
suicide? No, but more often than not.
It shows you care and that you're willing to, that you want them on this earth.
Yeah, and it gives them something besides the depression voice or anxiety voice in their head that is making them suicidal. Also, Lawrence and I both have had, both have depression. We both started being depressed when we were 7, obviously 40 years apart, but we had different experiences with it. So my experience with thinking along suicidal lines was before I got treated for depression. And basically my thought was, there's no way I can go through my life like this. At some point, I'm going to kill myself. So that was like, I'm going to want the pain to stop. Not I want to die, but I want the pain to stop. And Lawrence had the more classic suicidal ideation.
Which was kind of just, I really don't want to live. I mean, I a lot of the time had suicidal thoughts in response to something like me screwing up or something bad happening to me. I was like, wow, I really want to die right now. And a lot of the time I just, didn't want to deal with life. I didn't want to have to worry about things. And I was like, wow, if I was dead, this would be real cool.
Yeah. Yeah, but you also had kind of an intrusive thoughts thing also, where it was coming from the depression. So myth 3 about suicide, people who are talking about suicide are just trying to get attention. So 99% of the time, this is not true.
Obviously, there's going to be people who do it for attention, I see that a lot on like Instagram and stuff. People like from 13 to 15, and they're just trying to do it to get attention because they think, people will be like, oh no, don't kill yourself. Oh. And it's like, that's scummy. And if you do that, you're a terrible person.
Yeah.
And, but a lot of the time, people who are talking about like, hey, I actually want to die,
Yeah.
I'd say that should be taken seriously.
Yeah, and actually, for all the people who are talking about it, there are many more people who don't talk about it.
Yeah.
So the thing is, take it seriously, because the chances are that if someone's talking about it, then they are serious. Also, if they're giving away their possessions, and if all of a sudden they're happy after being depressed, or they're saying things that say kind of like goodbye, that's when you need to talk. So myth 4, talking to someone about suicide will give them the idea or make it more likely that they'll do it.
No.
Not true. This has been disproved absolutely 100% by the medical community. Says this is absolutely 100% not true.
I mean, I think in a lot of cases it would have the opposite effect, because they're learning that somebody, they care enough to talk about it. They're like, if somebody's willing to ask you, hey, are you suicidal? That means they care. They care about you. And in my experience, when my mom was like, hey, are you suicidal? It showed me that, wow, somebody actually cares.
Yeah, and I think it helps also, if you're talking about it, also helps take them out of their own head a little bit and connect them. Because one of the problems with depression is that a lot of times the depressive thoughts or just someone's own insecurity tells them that they're just a burden to other people, and no one would really care if they died. And so just talking to them lets them know that's not true. And you also will not put the idea in their head. And that kind of leads to the last myth. There are probably others, but I just picked the 5 most prevalent. Young children don't commit suicide. That's not true. Children as young as 5 do commit suicide. In fact, there is a theory in the medical community that some deaths among young children that look like accidents were actually suicides. And don't believe that young children do not have the intellectual capacity to plan and execute a suicide.
I was suicidal very early on.
Don't make that assumption.
Very early.
Yeah, don't make that assumption.
So the first, I'd say arguably most important thing is to find somebody you can trust to talk to about suicide, whether that be a family member, friend, even the suicide hotline.
Religious leader.
Maybe a priest if you are religious.
Priest, minister, whatever.
Yeah, because being able to talk to somebody...
Teacher.
Yeah, being able to talk to somebody about this is important. You can go to them and be like, hey, I'm feeling suicidal. Can I talk about that? And another good thing that comes from this is having somebody who can regularly check on you and ask you how you're doing. It's even better if it's a family member because they live in the same house as you. They can check on you, be like, hey, are you feeling suicidal? Do you want to talk? And that's great. I myself built support network of friends pretty early on, and I still have a support network. And it's great for me to be able to go to people and be like, hey, I'm really not feeling well. Can we talk about it? And yeah, that's a great first step. And that also leads into the next thing I'd recommend, which is having somebody you live with, making sure that there are not any items in your proximity which can be used to execute a suicide. Large amounts of prescription meds, maybe guns. If there are guns in your house, you can ask your family to either maybe get a lockbox with a combination on it, or maybe even move them, like to a safety deposit box, a storage locker, something like that.
Yeah, because proximity to items, methods, does increase the likelihood.
Yeah. And I definitely think that, yeah, when you have a moment where you're like, okay, I need to focus on, like, you're not being plagued by suicidal thoughts at the moment. You have a moment of clarity. You got to be like, okay, I need to do this. Because as she said, proximity does increase the likeliness. Another thing is treatment, like treatment from a medical professional. That is really important to seek out if you aren't already seeing a therapist. If you are,
should also if you have depression or anxiety, you should not only be seeing a therapist, but you also should be seeing someone who can diagnose, who diagnoses your condition and also can prescribe medication. You might not actually have to have medication, but you need
important.
Both things.
Can prescribe medicine is the keyword.
I think the thing is that if for insurance, if you're going to have therapy, you first have to be diagnosed by a psychiatrist.
And I'd say that, it's a trained medical professional. You can talk to them. They went to school to be able to know how to talk about this.
We realize that not everyone has access to health care, especially mental health care. So there could be a couple problems. One could be that you have parents who are not able to accept that you need help for either anxiety or depression. We realize that could be the case. So I actually wrote an article for teens with depression. It also applies to anxiety, and I'll link to it on how to go about it. Yeah. If your family is, a loving, caring, understanding family, but you don't have access to mental health care, there are other options. There is always a way to get that care. At a minimum, if you don't have a doctor to talk to or a therapist to talk to, you should call a suicide hotline. So you have to be in touch with people who are trained to handle this as well as your friends.
Yeah,
and
they
family.
are, the person at the other end of the phone is a stranger, but they're a trained stranger. They know what to do.
They're also there because they want to they want to help people who are...
They have a desire to...
And a lot of them have been through this.
Yeah, they want to make sure people don't get hurt.
Yeah.
The last thing is less a thing to do, more a thing to remember. Having suicidal thoughts, maybe even attempting it, that doesn't make you weak or cowardly or, a bad person. Having these thoughts is none of that. It is a sign that you are going through some bad stuff. And
your depression and possibly anxiety could be causing these thoughts. It's actually a symptom of depression.
Yeah, and it's not your subconscious being like, wow, you suck, die. It's like your depression being like, die, loser, because it's awful, because depression is an asshole. It wants to make you suffer.
Yeah.
And
it lies. A lot of people say depression lies.
For sure.
Depression lies. Your depression voice lies.
And don't listen to it. Be like, hey, depression, you suck. Shut up.
Yeah.
I mean, obviously, sometimes people don't like to personify their depression because they think it's weird or silly, but I do.
Sometimes it helps. Yeah, sometimes it really helps.
My depression's an asshole.
Some people even name it.
Oh, yeah. I've heard of that.
Yeah, name it and personify it, and it will say, like, Alice, shut up. Literally, for some people it helps. Doesn't hurt to try, right? Yeah.
Never hurts to try.
So for parents or adults who know a child or a teen that you're worried about, there are some things to bear in mind. Of course, the myth that we talked about, that talking about suicide will increase the chance that someone commits suicide. That's not true. But of course, it's an uncomfortable conversation, and it's an awkward conversation. And
I mean, even just starting, it's like, are you suicidal? They're going to be like, okay.
Yeah, you may be afraid you're going to offend them. I mean...
And so obviously sometimes they aren't going to be suicidal, and it's still a good idea to check. Unless they're, really sensitive, they're not going to be offended by you asking. You just want to make sure they're not, going through that.
And there are other ways to ask, and especially if you're talking about a younger child, some of them might be preferable to just coming out and saying, "Are you suicidal?" Sometimes the thing to remember, especially about younger children, sometimes they will be upfront about being suicidal, and sometimes they won't. So this is something that you, as an adult, have to help them understand, and you have to help them talk about it. So there are some ways to bring it up. For instance, are you thinking about dying? Are you thinking about hurting yourself? Are you thinking about suicide? And if they are thinking about suicide, this is something that I used to ask Lawrence. Okay, if he said he was thinking about killing himself or was thinking about suicide, I'd say, do you have a plan, or is this a vague, is this like hypothetical? Is this just a concept? I mean, and there's probably a way to say that for younger kids, but, so you want to see if this is something that is immediate, or if it's not in the plan. You want to see if it's in the planning stages or not. If they say that this is something that they have thought about, or they actually have thought about a plan, then that's when you immediately call their pediatrician or their psychiatrist, their mental health professional, and you consider taking them to the emergency room. Okay.
If you think
it depends how much you know about mental health, about depression. Okay. If you feel like you can't handle this, that's totally understandable.
It doesn't make you a bad parent or anything like that.
No. And if your child doesn't have a medical professional, I mean, this happened like the first time this came up, it was on the weekend. So we actually had to call. You didn't have a therapist. You didn't have a psychiatrist. Well, you had a psychiatrist for ADHD medication, but not for depression. And so we actually had to call a therapist. We knew because someone we knew had been seeing this person. So if you're in a situation where you don't know who to contact, again, call the suicide hotline. So they're trained. They can help you decide what to do. But
call the suicide hotline up. Be like, hey, child, can you please talk to these people? They're going to be able to help you better than I can if you are not super familiar.
And a couple things also to remember: don't be patronizing, okay, and don't be judgmental. Okay, this does not make them a broken person. It doesn't mean
it's not their fault.
It's not their fault.
Not at all.
Chances are, if you're watching this video, then you are not one of the people who thinks that it means they're weak, or that it's not a reflection on you. Okay.
No, not at all. I forgot. I was going to say that, but I forgot.
Just remember, if this was a physical problem, for the most part, you wouldn't be saying, this means I'm a terrible parent.
Yeah, okay? No. This is something
just because it's up here doesn't mean that it's necessarily related to
your parenting or anything.
Or real life, okay? This is a disease, it's a disorder that can have absolutely nothing to do with their life.
This is nobody's fault but the fault of depression.
Yeah. So don't be judgmental and just listen, okay? And encourage. Kids sometimes, especially younger kids, well, especially teenagers too, are not communicative, okay? They're not. Some of them are great and are able to communicate and want to communicate, but most of them either aren't really good at communicating or how they're feeling or don't want to. And that's another thing. Do not let them just hide themselves away, okay? Don't let them just stay in their room, okay? You have to keep them connected with the rest of the family, with the rest of the world. So they can have some time to hide out in their room, but the more time they spend by themselves, if they're suicidal, it's just not a good idea overall. And as we talked about, get anything that they could use to kill themselves out of reach in some way. It's very important.
Very.
Also, so encourage them to keep talking to you. Make sure that they know that you are not judging them in any way.
You just want what's best for
Yeah. And don't make sure they're not feeling embarrassed. Be as a matter of fact as possible. I think at some point we got very matter of fact about talking about Lawrence feeling suicidal. I mean, it was kind of like a temperature check. So, have you been feeling suicidal? Yes. Okay. Well, is this, do you have a plan, or do you have, I mean, it was really just kind of like any other medical check you might do with your child. Be matter of fact about it, and then they'll start feeling matter of fact about it.
Yeah, they're going to be more able to talk about it.
I mean, I was very matter of fact about my depression. You were able to end up being very matter of fact about it, and just, it is what it is. Okay, so just try to keep the angst out of it on your side for sure, and just be calm and dispassionate, and just this is just another medical issue.
Yeah.
So also both we're gonna put some links below for friends of kids and teens, parents or adults for kids and teens, of more information, including ways for there are some good articles for teenagers. How do I talk to my friend who is suicidal? Then there are good articles for parents, but it also applies to any adult. You could be a teacher, you could be a relative, you could be a neighbor, you could be the parent of a friend of theirs. If you don't feel like anyone is really paying attention, so you may be told at some point by their parents to butt out, but you know what? If you don't do anything, I hate to say it this way, if you don't do anything and they kill themselves, you don't want to live with that, okay? And same thing to parents. Don't be embarrassed. Don't let them put you off. Don't care what anyone else thinks, okay? The important thing is that the child or teen survives, and that's the important thing.
In any case, we hope you found this video helpful. If you liked it, you can give it a like. If you didn't, give it a dislike. If you'd like to say anything at all, you can leave it in the form of a comment. And if you want to see more of this content, then go ahead and subscribe. In any case, we hope that you have as good of a day as you can during these trying times.
Take care.